what you find is that patients with chronic wounds are more likely to shuttle frequently between inpatient and outpatient settings. Sometimes this frequent shuttling is warranted, but oftentimes what happens is that patients are discharged prematurely or the wounds quickly deteriorate in outpatient care settings, and this ends up having a really repeated vicious cycle of admission and readmission. Patients who are the very easily recognized people who suffer from burden with chronic wounds, they endure a lot of pain, a lot of suffering, significant loss of quality of life. And what you will really find is that some of these pain and suffering and quality of life loss is actually very avoidable. And the reason why it happens is because of late intervention. Right? Healthcare providers also, they have to juggle a lot of resources. They have significant challenges with skills training, with time management. And what you will find is that oftentimes productivity really comes down. And because of this, it affects the clinical outcomes that you would expect to have. The caregivers as well, they have to sacrifice a lot of time. They shoulder a lot of frustration. And there is a significant stress that comes together with this, not to mention that incidental cost that comes with a prolonged wound care journey, and this really comes back to a complete and total financial burden. Now, we in society as large also are not immune to the burden of wound management or wound problems, right? And what you will find is that there is a significant decrease in workforce, there is a decrease in productivity, and because of that, there is a higher imposition on welfare, and you end up with significantly less productive members of society, which is definitely not an outcome that we would like.